Hello and welcome. Today we're going to be reviewing a book called Evolutionary Psychiatry, Current Perspectives on Evolution and Mental Health. I'm going to be today discussing part 1 that includes chapters 1, 6, 7, 9, 14, 15, and 19. There have been no major breakthroughs either in the treatment of schizophrenia for 50 years or in the treatment of depression for 20 years. And it's worth mentioning that evolutionists consider the environmental context to be of paramount importance in determining the existence and nature of mental disorder. So there is an important point is that when mutations occur in germ cells, as opposed to somatic cells, they can be transmitted to offspring. So they don't get transmitted if the mutation happens in somatic cells. And there is an important rule in evolution which states that selection favors reproductive success at the expense of health and well-being. So evolution just care about giving offspring, but this is gonna come at the cost to the individual. He's gonna suffer from competitiveness, greed, envy, reduced cooperativeness, worrying about dangers faced by children, and unquenchable sexual desire and jealousy. So there is an illustrated example about a phenomenon called derailing of an evolved mechanism. And this can be illustrated by what is called the cuckoo bird. Um, and this bird is interesting because he lays his eggs in another bird nest. For example, at the great reed warbler. So when this great reed warbler see the chicks of the cuckoo bird opening their beaks wide, this exploits the paternal instincts in this bird, so he feeds them. So by that, the cuckoo bird's chicks has been raised, let's say for free, and he did not has to do that job. Somebody else had that job for him. And there is another rule here. It's called the parental investment theory, and it says that the sex that invests more in its offspring, for example, including the size of gametes, gestation, lactation, and childrearing, will be more selective when choosing a mate. This obviously talks about females humans. On the other hand, the less investing sex in these things is going to engage in more intra-sexual competition for access to mates, such as these two male deers competing on a mate. A phenomenon described in this book is called parent-offspring conflict. So, while the mother or father is related to their offspring by 50%, the fetus is 100% related to himself. So in other words, the child cares about himself 2 times fold what each parent does care for him. Another principle discussed in this book is the smoke detector principle, which is basically that says that high number of false alarms, false positives, are still safer than a low number of real adversity, false negatives. So in other words, it's better safe than sorry. Some mental diseases can arise due to infections. For example, if we have some streptococcal bacteria in some people, creating antibodies for this bacteria is gonna auto-infect the human himself by, for example, damaging the caudate nucleus, which leads to obsessive-compulsive disorder. There have been also ongoing suggestions of a link between toxoplasma and schizophrenia. It has been recently described that toxoplasma can infect mice, inducing fearlessness in them, and then mice are gonna go to cats, they're gonna get eaten, and they're gonna divide and live in the cat host cells. In general, evolution has been described as a tinkerer, shaping adaptations from available biological systems that work just well enough for survival and reproduction. So it must work with whatever it has done before. So it's a kind of a quick fix for the individual. Here is a spectrum described. So on one tail of the spectrum, we have schizophrenia, which is described as overactive mentalizing or mentalistic cognition. On the other end of the spectrum is the high-functioning autism spectrum disorder, which is characterized by underactive mentalizing and mechanistic cognition. So there is a fun fact about human brain. Human brains actually constitute just 2% of the weight of the body, but it consumes 15 to 20% of the energy from the body. The book also talks about what is called the gene culture coevolution, which has the other name dual inheritance system. So this rule it talks about that both genes and culture, both of them undergo evolution, and this can explain a couple of phenomena, and they explain that. So as you can see here, over a couple of millions of years, chimpanzees didn't change a lot, but humans have undergone uh, some major big changes. Another example is that um, why does humans have a small mouth, small teeth, and small stomach and shorter colon, although they have big bodies? And this can be explained by the use of fire in cooking, so that has to do with culture. And this also explains the reduction of physical robustness, because when humans have transitioned to using projectiles, they don't need those bulk of muscles anymore, so that reduces their physical robustness. So explaining why mental disorders persist can make psychiatry more like the rest of medicine. And why is psychiatry may be different from the rest of medicine? It can be because observable tissue pathology is usually absent in those psychological disorders. And by the way, have been observed that higher rates of suicide in psychiatrists exist compared to other physicians. And this book talks uh, about one of the benefits of depression, and it says that it can be useful in unappropriate situations where efforts will be wasted or harmful. So it's a kind of the harder you try, the worse it gets. Some people call it the law of reversed effort. This also the book talks about a phenomenon called adaptive sensitization. So in normal pain, usually a person gets pain and he gets a reflex, like for example, removing your hand from the oven, and after that the pain fades away. But when you get a big amount of pain, so you're gonna do the reflex again, so the pain is gonna decrease, but pain has decreased, but there is still a lot of pain. You see it here. So this indicates that the mild cues of nociception have been insufficient to provide protection against tissue damage. And this adaptively sensitized nociception and pain systems, so they go off more easily. So the body becomes more sensitive to pain because the threshold for pain has decreased, and that leads to chronic pain. So this positive feedback cycle goes on and on. And also there have been observed that there is massive overlap between some psychiatric disorders. So there is massive overlap of alleles contributing to anxiety and depression, and there is massive overlap for alleles contributing to bipolar and schizophrenia. And there is an interesting fact. So in schizophrenia and autism, it's associated with creativity and educational attainment. And on the other hand, ADHD is associated with risk taking. So it improves the chance of discovering new opportunities around the corner. So and also ADHD people can outperform others in stressful changing conditions that require intense physical activity. There has been um, mentioning of what is called the path dependence major transitions. Another name is for it is genome lag, and it basically says that natural selection is too slow to catch up with the modern world. And this can precipitate to some mental disease, like for example, the development of language has been cited as a specific explanation for vulnerability to schizophrenia. And the book says that a high level of anxiety can lead to lost opportunities. So this is a bad thing. And high level of depression reduces useless effort. So that's a good thing, but at the cost of lost opportunities again. The book also talks about immunity, so it's like a double-edged sword. So if immunity of the body gets stronger, it's true that it's going to improve the protection against infections, but it's going to be at the cost of increasing the risk of autoimmune disease. Um, um, the book also describes a phenomenon called frequency-dependent switching. So in some areas where malaria is endemic, um, there has been a mutation has appeared, which is the heterozygous sickle cell trait. And this heterozygous genotype, if you have it, is going to improve your resistance against malaria. So it's going to improve the survival and number of people, of these people, because they have this heterozygous genotype. But then, when these people increase in number, the mating between them is going to increase, and this is going to increase the number of people who have the homozygote genotype, which is basically the sickle cell disease. And you know, sickle cell disease is associated with mortality. So when people die, there's going to be decrease in this sickle cell allele in the population, and this is gonna increase vulnerability to malaria. And so this cycle keeps going on and on. An interesting fact, so obsessive compulsive disorder is the only anxiety disorder where the difference between males and females susceptibility is small. So other anxiety disorders, male to female ratio is about 1. So there is in the clinic a lot of people ask if antidepressants just simply cover the symptoms. Well, these patients may appreciate learning that using medication for some months to stop panic attacks, for example, helps the system to become less sensitive, thus making long-term improvement likely even after the medication is discontinued. So it's a kind of breaking the positive feedback cycle, like the one chronic pain that we have just been talking about in the previous slides. So it's worth mentioning that suicide is an extremely unlikely outcome, and rarity of completed suicide among human adults with severe intellectual disability can be a proof that intellectual ability is necessary to complete a suicide. And here the book is describing a balance, so you can either use energy efficiently, for you have to make a choice here when it comes to suicide. You can invest these mental tasks for blocking self-killing. You can think about stuff that is gonna stop you from killing yourself, but this is gonna be at the cost of impairing the emotional and cognitive functions that the organism needs to complete successful against other mature adults for mates and other resources. And unfortunately, in the clinic, physicians worry about potential liability when executing suicide risk assessments because sometimes it can case a false negative result and the patient will actually die, he's going to suicide, and that physician will be in trouble. So unfortunately, this causes these physicians to overrate the hazard, which increases the false positive rates. And by the way, so acceptance of suicide's essential randomness as an enforceable biological accident would help to ease the irrational guilt that often besets people behaving this way. So when it comes to life history, there are kind of two pathways. It can be fast or can be slow. So fast life history cares about the quantity of offspring, but the slow life history cares about the quality. So in the fast life history, you get children at a younger age, they are nurtured less, so there are less investment in them. But in slow life history, you get children at an older age, and you're gonna put more investment in nurturing these people. And the harder the life of the individual, the harder the larger the adversity that the child experiences, the more likelihood that that child is gonna follow the fast life history. Whereas if your child life was easier per se, he's gonna more likely to follow the slow life history. Good rearing in children is gonna result in a securely attached children, and this constitutes 50% of the cases. But when it comes to child abuse in a form or another, it's gonna lead to insecurely attached children. And these can be subtypes in three types: avoidant, ambivalent, and disorganized. So avoidant, which happens in 25% of children, is caused by neglectful, distant, and unresponsive caregivers. It blocks the child need for human connection and growing up detrimentally self-sufficient. And also it makes him able to avoid antagonizing their caregivers or making demands that the caregiver will rebuff. So that child maintain an indirect but real proximity to his caregiver, as well as a regulatory control to continue to be responsive to the environment. And it makes the child compulsively self-reliant. The second subtype is ambivalent, happening in 15%. It happens when there is an inconsistent caregiver who swings between being intrusive and being dismissive. So it leads to hyper-tuned children to their attachment figures. And these children can be extremely sensitive to any hint of withdrawal or intrusion, consequently tend to struggle to relate empathically. It helps that child to maintain proximity to his caregiver in potentially dangerous environments, but it leads to a clingy and compulsively care-seeking child. The third type is disorganized, happening in 10% of the cases. So when it's abused child or when he is neglected or cared by a parent with mental illness, such children experience fear without selection, as their caregiver, to whom they are primed to turn when they are scared, is also the source of their fear. So these children, being emotionally dysregulated, they have a high chance of psychiatric and physical disorders later in life. At its extreme, it includes psychopathy, in which individuals survive and even thrive by caring only about themselves and exploiting others. And by the way, this disorganized attachment is not a proof of maltreatment. For example, a parent who has unresolved trauma may have flashbacks and periods of dissociation. And so when the child observes this frightened caregiver, he can be traumatized too. Early emotional insecurity leads to a sensitized, hypothalamic pituitary adrenal axis, which leaves the individual forever on the lookout for danger, even after a perceived threat has passed. This leads to a couple of issues, such as cardiovascular disease, memory issues, and self-fulfilling prophecies, which is basically that you end up being the reason behind your problems. You create your issues. Also, children can be classified as resilient or plastic. So when life circumstances is hard, resilient people can do better than plastic individuals who will suffer in the same life difficulty. But on the other hand, if life circumstances was easier, plastic individuals are gonna do better than their resilient counterparts. Autism occurs more commonly with increased paternal age, when fathers are more established, so it makes sense. And it follows a slow life history, so the father is most likely following the slow life history pathway, so he invests more in his child, uh, the quality measure. And there is the phenomenon of group selection. So autistic people, uh, they they may exist these days because they are they are specialized in certain jobs. So they benefit the community because they are the only people that can do this special job right. But this is going to be at the cost of on the individual because he's going to be feeling isolated. So it benefits the group, the community, but it's going to be at the cost to the individual. So that is what group selection is. This chapter describes a phenomenon. So a patient was shown two pictures, one of a chicken leg and one of some ice storm, and he was asked to choose some image relevant to those images. So he chose the shovel for the snow, and she chose the chicken for the chicken leg. And then when he was asked, why did you choose the shovel? He said, to pick up the snow. So it means that information was transferred through the corpus callosum from the left brain to the right brain, where the language center exists. Then he described what he saw. On the other hand, if we have a patient um, who undergone some corpus callosotomy surgery because, for example, he had treatment-resistant epilepsy, for example, and if we do the same experiment, we did the same experiment for him, and then he was asked, why did you choose the shovel? Surprisingly, he did not mention the snow, but he said he chose it to clean out that chicken shed. So this means that he did solve the photo evidence because it crossed the optic chiasm, but it didn't cross to the other side. So it means that the right brain was blind from the left brain.